College can be one of the most exciting and rewarding times in an individual's life, opening the door to pursue new knowledge, prepare for a future career, and experience life in a new way. It can also be a very challenging time for students. Leaving home for the first time, learning to live independently, forming new relationships, sleeping irregularly, and being confronted with greater access to alcohol and drugs can be overwhelming for many students.
Depressive illnesses tends to peak between the ages of 15 and 24, just as academic pressures are mounting and students are adjusting emotionally to complex life changes. Depression is a common but serious mental illness, typically marked by sad or anxious feelings. Most college students occasionally feel sad or anxious, but these emotions usually pass quickly within a couple of days. Untreated depression lasts for a long time, interferes with day-to-day activities, and is much more than just being a little down.
There are different types of depression, but there are 5 types of depression that a college student can experience without them noticing it. And these are the most common types of depression. Major depressive disorder, also called major depression. Dysthymic disorder, also called dysthymia. Minor depression. Other types of depressions include psychotic depression, seasonal affective disorder. Major depression may occur on college students in their everyday activities such as studying, eating, and sleeping. Dysthymia is mild chronic depression. This type of depression lasts for a long time, 2 years or more. Even though it is less severe than major depression, it can still interfere with their everyday activities. Minor depression. This is less severe, and it is usually shorter term than the major and dysthymia depression. If it is not treated early, it has a high risk of developing as a major depression. Psychotic depression. This is a form of psychosis. College students can experience hallucinations and delusions. Seasonal depression is a depression that occurs in specific seasons or months and lives during a specific time too.
And there are causes of depression, but it really doesn't occur in a single serious cause. Several factors or causes can lead to depression. In their environment and life experiences, such as stress, it can also affect their health that can lead to depression. The stress of college students may include some of the following: living away from family for the first time, missing family or friends, experiencing conflict in relationships with family member or friends or people around them at school, feeling alone or isolated, facing new and sometimes difficult schoolwork, worrying about finances, school grades, and school performances.
With all the causes of depression discussed earlier, there are also certain risk factors that occur when it comes to depression. These risk factors may make a person more prone to develop depression, such as family history of depression, adverse childhood experiences, stress, illness, and gender. These are not a complete list of all factors, however, it is a good place to start. In family history of depression, maybe someone in their family or relative experienced depression. Adverse childhood experiences are the stressful or traumatic events they encounter when they were young and it developed while growing up. The stress they experience in school or at home or even at the surroundings or also the illness they are going through may lead to developing their depression.
There are certain warning signs that can help you identify whether you or someone you care about may be depressed. What are the signs and symptoms of depression? The signs of depression are those outward manifestations of the illness that the doctor can observe when she examines a patient. Symptoms are those subjective things about the illness that only the patient can observe, such as feelings of guilt or sadness. If you are depressed, you may feel anxious, empty, hopeless, worthless, helpless, irritable, restless. You may also experience one or more of the following: loss of interest in activities you used to enjoy, lack of energy, problems concentrating, remembering information or making decisions, problems falling asleep, staying asleep, or sleeping too much, loss of appetite or eating too much, thoughts of suicide or suicide attempts, aches, pains, headaches, cramps, or digestive problems that do not go away.
How is depression treated? A number of very effective treatments for depression are available. The first choice for depression treatment is generally an antidepressant medication. Psychotherapy or talk therapy is another effective and common choice. Antidepressants work on brain chemicals called neurotransmitters, especially serotonin and norepinephrine. Other antidepressants work on the neurotransmitter dopamine. Scientists have found that these particular chemicals are involved in regulating mood, but they are unsure of the exact ways that they work. But remember, always follow the directions of the doctor or healthcare provider when taking medication. Psychotherapy or talk therapy is another effective and common choice. A therapist, such as a psychiatrist, a psychologist, a social worker, or counselor, can help you understand and manage your moods and feelings. You can talk out your emotions to someone who understands and supports you. You can also learn how to stop thinking negatively and start to look at the positives in life. This will help you build confidence and feel better about yourself as you begin to work with your therapist to find solutions to problems that may have seemed insurmountable when you were feeling depressed and maybe even hopeless. Types of psychotherapy often used to treat depression include cognitive behavioral therapy or CBT, which helps people change negative styles of thinking and behavior that may contribute to depression. Interpersonal therapy or IPT, which helps people understand and work through troubled personal relationships that may cause or worsen depression. Dialectical behavior therapy or DBT, which is especially useful when depression is accompanied by self-destructive or self-harming behavior. Besides seeing a doctor and a counselor, you can also help your depression by being a patient and treating yourself better. Then you will see to yourself that you are improving gradually over time. Daily exercise, spending time outside in nature and in the sun, and eating healthy foods can also help you feel better. Even a 30-minute walk in a green setting has been shown to have an impact. Many college campuses are located in beautiful settings with easy access to walking or hiking trails. Finding time to sneak away even once a week could have a significant impact on your mental health. Get enough sleep. Try to have consistent sleep habits and avoid all-night study sessions. Your counselor may teach you how to be aware of your feelings and teach you relaxation techniques. Use this when you start feeling down or upset. Avoid using drugs and at least minimize, if not totally avoid, alcohol. Break up large tasks into small ones and do what you can as you can. Try not to do many things at once. Try to spend time with supportive family members or friends and take advantage of campus resources, such as student support groups. Talking with your parents, guardian, or other students who listen and care about you gives you support. Try to get out with friends and try fun things that help you express yourself. As you recover from depression, you may find that even if you don't feel like going out with friends, if you push yourself to do so, you'll be able to enjoy yourself more than you thought. Remember that by treating your depression, you are helping yourself succeed in college and after graduation.
If you or someone you know have symptoms of depressions that are getting in the way of your ability to function with your studies and your social life, ask for help.
Depression can get better with care and treatment. Don't wait for depression to go away by itself or think that you can manage it all on your own. And don't ignore how you're feeling just because you think you can explain it. As a college student, you're busy, but you need to make time to get help. If you don't ask for help, depression may get worse and contribute to other health problems, while robbing you of the academic and social enjoyment and success that brought you to college in the first place.